Hello everyone, my name is Basel Abdelazeem. I am a first year internal medicine resident at McLaren Flint program. This is a teaching site of Michigan State University. It's my honor today to present to American College of Physicians Michigan chapter. I'm presenting a case report of a sick sinus syndrome as an initial presentation of primary amyloidosis. Authors are myself, Dr. Bilal Malik, Department of Internal Medicine, Dr. Rodin Jenka, Department of Cardiology, and Dr. Arvind Kunadi, Department of Internal Medicine. Disclosures: no relevant financial disclosures. Introduction: Primary light chain amyloidosis (AL amyloidosis) rarely presented as a sick sinus syndrome, and only a few cases have been reported in the literature. A higher index of suspicion is needed to diagnose AL amyloidosis in patients presenting with sick sinus syndrome. Recognizing the electrocardiography (EKG) and transthoracic echocardiogram (TTE) finding for amyloidosis are crucial for early recognition, proper management, and to improve the patient's quality of life. Case description: a 79-year-old African American female presented with shortness of breath. EKG demonstrated sick sinus syndrome with sinus bradycardia, pauses up to 3 seconds as we can see here in figure 1, and atrial fibrillation AF with a rate of 130 beats per minute. The patient underwent urgent pacemaker placement to prevent further sinus pauses. 10 days later, the patient had a complaint of dysphagia and difficulty swallowing. Esophageal-gastroduodenoscopy revealed esophageal and duodenal ulcers, and the biopsy confirmed the diagnosis of primary light chain amyloidosis. 2 months later, the patient presented with persistent, progressive shortness of breath. Transthoracic echocardiogram demonstrated an ejection fraction of 60%, small pericardial effusion, left ventricular posterior wall diastolic thickening 1.4 cm, normal range between 0.6 to 1 cm, right ventricular systolic pressure was 56 mm mercury, and mild to moderate biatrial enlargement, as we can see here in figure. Here this is the right atrium, and this is the left atrium. Kappa to Lambda ratio was 74.1. Due to the terminal nature of the patient condition, the patient was discharged with comfort measure to hospice care. Discussion: Conduction system abnormalities are a potential complication of amyloidosis due to amyloid deposits infiltration of the conduction system. EKG findings include low voltage QRS, less than 5 mm in the height on the limb leads, with poor R-wave progression in the chest leads, first or second or third degree atrioventricular block and AF, and ventricular tachycardia. Transthoracic echocardiogram features that support the diagnosis includes increased left ventricular wall thickening, low ventricular volumes in both systolic and diastolic phases, biatrial enlargement, mildly thickened valves, and pericardial effusion. Conclusion: Primary light chain amyloidosis is a rare disease that can be presented with sick sinus syndrome. Screening for cardiac involvement should be considered in all patients with amyloidosis. We presented a case of 79-year-old African American female who presented with sick sinus syndrome as the initial presentation, complicated by dysphagia and restrictive cardiomyopathy, and was diagnosed with primary light chain amyloidosis. This case highlights the importance of early recognition of primary light chain amyloidosis by EKG and TTE to improve the patient's quality of life. Thank you so much. End of presentation.